Capitol Report is a production of Senate Media Services.
On this week's program, mitigating flood damage around the state, providing housing services for the mentally ill and former inmates, and saving for retirement. All of this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. As chair of the Capital Investments Committee, Senator David Senjem has taken the "if you build it, they will come" approach to tackling problems of mental illness and recidivism among the prison population. He has sponsored legislation to provide housing and services to former inmates and to develop regional behavioral health crisis programs throughout the state. He now joins me in the studio. Welcome.
Good to be here.
With the proposed legislation that you talked about in Capital Investments Committee yesterday and the Unlocking Opportunities Grant Program, you're demonstrating an increased commitment to community-based programs to help individuals and families. Why?
Well, Shannon, the bills that we had before Capital Investment yesterday had to do with mental illness and how we deal with that across Minnesota. And I'll be honest, there's a lot of good efforts. I don't diminish those. But frankly, we need to do a lot better. We're at crisis proportions, I think, in terms of our ability to manage that population. It seems to be an ever-growing population. And so why did I get interested in this? Because I grew up with mental illness. It's just the way it was a long time ago, albeit, but you know, as I grew up in a little town of Hayfield, Minnesota, both my parents suffered from schizophrenia. Dad committed suicide when I was 12 years old. That's not easy for a young boy. And a couple sisters lived in a little town of Hayfield. But you know, we endured, and lessons in life. There's always love. There's no question about that. But Mother also suffered from schizophrenia all her life, till her last years, 94 years old. And while certainly the drugs certainly helped a lot, thank goodness they were there. There was always those episodes. Every year we'd get into another episode, and of course by that time we'd kind of learned how to deal with it, and it was just more of an inconvenience than a crisis. But I more recently have spent a lot of time during our break, 3 days in fact, in Rochester, in 3 different facilities that deal with mental illness, trying to get the length and the breadth of it, at least in my community. But I know what I saw there is very similar to what we see all over Minnesota, and that is basically we don't have the facilities, we don't have the infrastructure that's able to really effectively deal with these kind of patients. And there's a lot of good efforts, but it's still not there. And what we're going to do is try to make that happen in the capital bonding bill.
Well, and your committee is capital investments, right, rather than health and human services.
Right.
You said yesterday that you can't build the services, but you can build the structures. You've talked a little bit about the message that you're trying to send. Is this related perhaps to a legacy that you want to leave because you experienced mental illness growing up and you see the problems, you're calling it a crisis. Is this something you really want to try to help fix?
Well, certainly I want to help, and I'll never leave a legacy, and there's no question about that. But yeah, I think somehow I do feel I'm called to do this. If not me, who? And it just seemed to me that given my life experience that, and a lot of people don't want to talk about this, you know, and so I decided, okay, I'm going to start talking about it, and I'm going to carry my life experience into some legislation, and hopefully help people along the way. And so as a Capital Investment Committee, yes, we build things. I can't provide all the professional services that also are needed to make an effective treatment system work. But we can start at least by forcing the issue, forcing the conversation at the building level. And by the way, I hope to move these forward in terms of the building of what we call crisis centers across Minnesota initially, and then some behavioral health centers as well. So I happen to believe that if we build them, we will find staff for them. We need to. It's that critical. We're not going to build to an empty building. That building is going to be full of staff, and it's going to be made available for patients that need them. And by the way, more than likely, as many as we build are going to be overwhelmed almost immediately.
Well, and so this goes to a little bit towards the Unlocking Opportunities grant program that you created. There seems to be a correlation between mental health and incarceration. Can the state of Minnesota ever get ahead of these problems, do you think?
Well, one would hope, but we can't sit on our hands. We have to step up, and we need to deal with it. Now this program I'm just talking about has to do with prisoners coming out of our state prisons, about over 8,000 a year. Double felonies in almost every case. Not every case, but at least as far as this program, that's who it would touch. And you know, those people have little chance of doing anything other than returning to prison unless we do something, and that's really expensive. You know, $35,000 a year to keep somebody in prison. Can't we step up to some level and give them the support structure that they need to assimilate within the community, to get a job, have a house, have a roof over their head, and be part of a productive society? And I think they can. We just need to give them a head start.
Well, and in the bill, it refers to these individuals as locked out individuals. So what are some of the challenges that they face? If you've been in prison and you're getting out, what are some of the challenges that you're facing that this grant program would help to alleviate?
Well, for you know, as you leave that prison door, and of course I have never done this, but as you do, you probably get a bus ticket or something like this, and where you're going to come to Rochester, Minnesota, you're going to get off, and where are you going to go? There's nowhere. This will provide a local support structure, find you a place to live, begin to, again, teach you life skills relative to being on the outside, provide you at least, assist you in an employment search, and so on and so forth. But just to bring you back into society and make you a productive part of society. That's, you know, returning 62% to prison as we do currently is not a good investment of our time or our money. We better do better than this.
This is meant to really tackle the recidivism rate.
Exactly, right.
So in addition to providing housing for these individuals, the program would also require that services, as you mentioned, job placement, training, healthcare, parenting. Are those factors that contribute then to people having to return, that they just don't have a way to live? They don't know how to live when they get out?
Yeah, to some great degree, that's what we hear at least. And so, you know, we've got to create initiative in their heart. There's no question about that. But be able to provide some level of infrastructure support. I'm talking about human infrastructure, and again, a roof over your head. That's kind of what they need, and a little bit of monitoring and encouragement, and hopefully that 62% will lower, and we'll be better off as a society for it.
Did this unlocking opportunities, did it make it into the omnibus?
It's not in there yet, but the session's not over with it.
Session's not over. No. Senator Senjem, I want to thank you so much for your time today.
Okay, thank you very much.
Gillette Children's Specialty Healthcare marked its 120th anniversary with the celebration day at the state capitol. In 1897, the Minnesota legislature helped establish the nation's first hospital specializing in care for children facing complex medical conditions.
So the primary purpose of today is to acknowledge 120 years and to say thank you to Minnesota and the state of Minnesota for creating the nation's first hospital specifically to care for children who have disabilities. We service over 25,000 unique patients each year from every Minnesota county, all across the upper Midwest, the United States, and around the world. The majority of our patients come from Minnesota, and those are all kids who have complex, rare, or traumatic conditions. We don't have a traditional emergency room, we don't birth live babies, we don't do that kind of thing. We only do children with really complex neurological or musculoskeletal conditions, which is what the state established Gillette to do 120 years ago. It was very forward-thinking in 1897 to say, we can help these children and include them in public life and community. 120 years ago, the standard for children with disabilities was institutionalization. Gillette is an important, independent, freestanding children's hospital. We're independent of the state now. We do benefit from the state's support, though. A significant number of our children qualify for medical assistance because of their disability. And so the state's support of Gillette through funding for medical assistance and those kind of things are incredibly important, not just for Gillette, but for all children's hospitals.
I have cerebral palsy, and I didn't walk until I was 3. And when I did start walking, I needed a hand most of the time, and I couldn't jump or walk off curbs. Walking was not easy. Then, when I was 4, doctors at Gillette did surgery on me. I had a rhizotomy to help me walk. I spent 5 weeks in Gillette, followed by months and months of physical therapy, where I had to use a wheelchair, then a walker, before I could walk independently again. After that, I had 3 more years of surgeries for a total of 10, with the most recent being 2 years ago. I guess you could say I did not have the kind of childhood most kids do. But then again, because of the treatments I've had, I'm able to do things that I wouldn't have been able to do due to my CP.
You know, my experience with Gillette Hills Children's Hospital goes back many decades myself. I have some siblings with some fairly significant disabilities that went through a series of surgeries, some of which were successful and some of which weren't and had to be redone. And Gillette was with my family from day one.
Minnesotans have many demands for their hard-earned dollars, and for some, saving for retirement falls to the bottom of the list. In a recent survey, AARP of Minnesota found that more than half of the workers surveyed were anxious about having enough money for retirement. Joining me in the studio to discuss a possible solution to this dilemma is Senator Sander Pappas. Welcome.
Thank you.
Why is it in Minnesota's best interest to have retirement savings? Isn't Social Security enough?
Oh, I wish it was, but it's not. Let me give you the example of my Aunt Elsie. She's 87 and she's run through her husband's retirement money, and now she's living exclusively on Social Security. And her market rate apartment her Social Security is $1,000 a month, and market rate apartments run $900 a month. So that really doesn't leave her enough money even for food. So without the help from her children, which has been kind of in and out, she's really struggling. Yet if she had been able to sign up for a retirement plan years ago when she was young, even if it only brought her a couple $100s a month, that would be her food budget. So that's our problem, is too many people are relying on just one source of income for their retirement, and they need multiple sources.
The plan is called the Minnesota Secure Choice Retirement Act. And I understand there's 2 different choices. There's an individual choice and employer choice. Can you walk us through the individual retirement plan? Does it follow the employee through various employers? How does it work?
Absolutely it would. If we want to make it as easy as possible as we can for small businesses in particular who haven't been able to offer a plan, so it's just part of their payroll deductions that they do. The money is invested by the State Board of Investments, so individuals don't have to worry about investment choices, and it would follow them from employer to employer.
Okay, and then there's also the multiple employer retirement plan, which is essentially a 401k sponsored by the state, but available to the employer to offer to the employee.
This is something that I wanted to do that's beyond Secure Choice that AARP has been supporting throughout the country, because I wanted an option for employers who did want to also contribute. And so everyone's kind of scared off by ERISA, so we're making it more simple for employers to be able to offer a plan that they can also contribute to and double their employees' dollars that they're investing.
But this is then, it doesn't maybe cost as much money for the employer to offer this? Is that?
Well, it's optional for them.
Okay.
The basic Secure Choice IRA plan would be required by all businesses to offer that to their employees. But if they wanted to help their employees more as an incentive for people to work for them, they could offer the multiple employer plan, which would be more like a 401k.
Okay.
But again, we simplify the paperwork, the fees are low, it's invested by the state.
What prevents people from just starting their own retirement plans? Why do we feel like it needs to be through an employer?
Because they're not doing it. And they certainly can, and many people do, but for low-wage workers in particular, it's the investment choices are confusing for them. The fees are so high that they aren't gaining much money. Their interest that they're able to get, maybe only 4 or 5% or less, is gobbled up by fees. This is not really a competition with the private market because these people are not saving now. This would be an automatic deduction, automatic enrollment with their employer, and the fees would be low because we have a bulk of money already available with the State Board of Investment, and so there would be much more of an incentive for people to stay involved with it.
The plan addresses the access gap. People who don't have access right now to a retirement plan through their employer. But there's also an affordability gap. For many, saving for retirement is a luxury. They simply don't have enough money for there to be extra money.
Right.
So How would this help those
It
people?
could start small. It could start at 1% of their income, and because it would be an automatic deduction, it would be money that they'd never see. It's kind of out the door. And so I think that would be very helpful. And as we've surveyed, and AARP has surveyed low-wage workers, and some of them testified at our hearing, they're concerned about how they're going to save for retirement too. So there's a strong group out there that's motivated. You can opt out. So if people decide they really cannot afford to start saving for their living paycheck to paycheck, they could opt out of it. But the studies have shown that most people, 90% of people, if it's an opt-in where it's an automatic deduction, or not an opt-in, it's an automatic deduction, but an opt-out, that they just let the money stay in the savings account.
Well, and then they start getting statements and they start seeing it grow, and then they start to feel maybe more secure.
Right, and then we talk about what the rules are for withdrawal. Because typically if you withdraw money from a retirement plan, there are penalties. But people have emergencies, people want to pay for college, people want to put a down payment on a house. There are sometimes other priorities. So that's yet to be worked out.
So just making it easier to incentivize people to save for their future.
It's a public-private partnership. The state doesn't have to run it. We can contract with a private entity that already has the systems in place to be able to do this, so the startup costs are low. And I think it does have a lot of bipartisan support that in the studies that we've done, the surveys that we've done, 90% of Minnesotans think that the state should establish a retirement program for low-wage workers. 73% are also strongly supportive, that say they would save with a retirement plan that was available for them.
There is bipartisan support from my own reading as well, but one of the concerns from the Republicans is that it's potentially putting government in competition with private business and perhaps creating more burdens for small business. How do you address that?
So, as I said, you make it very simple for small business that they have a payroll system. They have to deduct for Social Security. They have to deduct for taxes, for state taxes. So it's just another item that they deduct for. So it shouldn't be that burdensome on small employees, small employers, and of course we do want them to educate their employers. So there's some of that involved through their HR system, whatever they have. The private sector has expressed concern, the financial services industry, but my argument is that these people are not saving with them now. So they're not their customers because there's not enough money here. There's not enough fees that they can get from these people, which is why it's just kind of a perfect audience for a public-private partnership.
Senator Pappas, I want to thank you so much for your time today.
Thank you.
On the occasion of her 75th birthday, Senator Ann Rest invited lawmakers and staff for a reception of birthday cake and Virginia peanuts to honor her birthplace. Senator Rest, with the help of Lieutenant Governor Tina Smith, drew names of attendees' favored charities for donations to recognize this milestone event.
It's a real privilege to start with, to be here, to try and make a difference for my constituents, for the people of Minnesota. Most of the time it's just a joy to work with my colleagues, both sides of the aisle, and it just gives me a lift every day when I'm able to come into this beautiful building and look at the beautiful building across the street that I've worked on the restoration and the construction of these two buildings for over 10 years. And it's just very, very thrilling to be here.
Well, it's not often that we would actually time our session to break around somebody's birthday party, so that tells you about the respect I have for Senator Rest. I've known her over 6 years. When we first met, I thought she was a little tough and a little rough. She still is, but what I found is at the heart, it's golden. And so her work and our work together, we've done a lot of things, taxes in particular, where we worked together and found solutions. And so it's been a real joy working with her.
We've served for many years together. We've been on conference committees, and Ann's expertise in actually several areas, but obviously notably tax, has been significant in the Senate.
Many will recall the devastating flood of the Red River Valley 20 years ago. According to a recent Minnesota Public Radio report, more than $1 billion has been spent on flood control projects along the Red River since then. Continuing to fund flood mitigation efforts throughout the state remains a priority for my next guest, Senator Mark Johnson. Welcome.
Good morning.
You witnessed the Red River flood in 1997. What are some of the physical and emotional impacts on communities who experience these devastating events?
Thank you for having me on. It's been now 20 years since East Grand Forks was hit by that devastating 97 flood. One of the things that we see in those communities are you have that initial impact of the floodwaters. You really have a community that gets together and really tries to protect one another from that water. But once those dikes have been breached, once the levees have failed, you really have a moment of just panic. Where do we go? What do we do? And what ends up happening is, there's a lot of depression, there's some mental health issues, because it's not just that your house gets flooded, it's that now we've got to figure out how to clean this up. Who's going to be able to do that? Can we go back and live there? What's our long-term plan? And there's just so many of these unknowns that happen after a flood. It takes so much longer than maybe other natural disasters to really pick up the pieces and get moving along. So that was, we talk about the 97 flood in East Grand Forks. Roseau had one a few years later. So we see that quite a bit in our neighborhood, in our neck of the woods, and just those long lingering effects from those floods.
Well, then it takes a long time for the water to go down, and it's still cold outside, and it's a different scenario than even a sudden summer flood.
Sure. And then what you also see is you're vulnerable. You're vulnerable to another one. So there's always that pressure of, hey, how is the spring? Do we have a quick melt? What's the storm pattern? So there's always this in the back of your head. What's going to be happening for the next storm or spring, so those things that we worry about year after year really do compound some of the stress.
So your bill would fund flood mitigation projects across the entire state, so not just the Red River Valley, but across the entire state. Your bill proposes issuing $20 million in bonds for projects. How will the projects be chosen?
What we find is that local watershed districts really have a handle on what the area needs to protect them. Up in northwest Minnesota, where I come from, it's very flat. I mean, if you take a pitcher of water and pour it out on the table here, it'll be very thin, but it'll spread out a long ways. And that's what it's like up in northwest Minnesota. So some of the things that we try to do up there, the local watershed districts do, or try to put in a system where it's almost like an ice tray, where you might have water running down the watershed, but if we can put in little dams, diversions, sometimes it's whole fields that they try to keep the water within, just in an effort to let the runoff below it really exit the area before this new water starts getting into that flow. So what that does is it reduces the level in the river from its peak that might be much higher had there not been that sort of mitigation. So for our area, that's a lot of it, just water retention and trying to do that. Now, if you're down in southwest Minnesota where you have a lot steeper banks, or northeast Minnesota where you see, a few years ago up in Duluth, they had the flood there. Completely different approach to flood mitigation around those areas. So it's really up to the local watershed districts to address the needs that they see in their local topography.
So the area topography really is a factor in determining. So that leads me to the question, it's the local watershed districts then that choose what types of flood mitigation strategies they're going to attach to the project.
Correct. And I think that's really the most effective way and efficient way to figure out how we're going to do this. So.
Well, and I think sometimes people think about floods and they think about protecting populated areas, but protecting topsoil is also important because you don't want it to run off with these big events. So so you've talked about diversions, there's levees. What are the tools in the toolbox to accomplish these things?
Sure. Well, there's a couple of projects that I'm thinking about. I was just up a couple of weeks ago during the break to go look up in Roseau County. One is an old lake bed that they're trying to levee around another water retention area where they build up the dikes, the levees around that in an effort to retain the water in there. And that's just going to be slowly released through the year, you know, so by September, October, it'll be dry again in there. But one of those ways is just regulating the flow of the water that's coming through that area. Another one that's not too far down the way is the Lake Whitney project, which farmers are having a lot of trouble with water coming and staying on their land and then running off, you know, once it starts drying up, taking some of that topsoil with it. So what we're trying to do there is, again, more of that ice cube tray situation, where we'll keep the water on part of the land, but then we'll make the drainage system, make the ditches and the drainage system a lot more efficient for taking that away in a way that protects the topsoil and minimizing how much spread we have on that land. So if you think about crops that are planted there, they can take a few days of being underwater. So if we have a rainstorm where it floods the land, this was going to try to protect some of those fields, some of that crop that's in the ground by maybe sacrificing a little bit more in a smaller area that can retain that water for a little bit longer. So that's the idea behind some of that.
One last question. Do they take into account environmental issues in terms of waterfowl and habitat for wildlife?
Yeah, that's a really good one, because when we're looking at the Roseau Lake project, there, you know, DNR is heavily involved with that one in a way that for nesting grounds and things like that, where they regulate the water level so that nesting can take place throughout the year. But then in the fall, you know, when it dries up, you know, the ducks and whatnot don't need to have that sort of habitat there, so they're able to move on. So that's one of the big concerns is habitat and how they're going to regulate and foster that within these projects. So that's a big item.
Senator Johnson, I hope this goes through and we can protect our water and land and cities for years into the future. Thank you for your time today.
Well, thank you. Appreciate it.
The Minnesota Farmers Union recently held a number of listening sessions around the state to discover the legislative issues that rural people are most concerned about. They spoke about their findings at a Capitol press conference.
This report captures the rural voice and presents a call to action for the administration and the legislatures that they need to address. Healthcare costs and accessibility are the most urgent issues we heard about. But we also must get answers on transportation funding for roads and bridges, create the reality of high-speed broadband, internet services, adopt property tax relief, adopt solutions to rural hunger, solve agriculture and farm problems for farmers of all sizes, and work on rural and farm labor issues.
The meetings that the Farmers Union had really reinforced what I have heard over and over again, which is that people in rural Minnesota want practical solutions, not partisanship. And they want people to listen to them. Most folks don't expect you to agree with them all the time, and they don't even expect you to solve all their problems, but they do expect you to listen and understand what's happening in their lives.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.